It is Medical Monday, and here with us now is Dr. George DeVries. You are specializing in foot, ankles. Tell us, you know, sprained ankles, they still cause problems even though they're just a sprain,
and everybody's
right?
played sports has had one, I swear.
Well, it's one of the most common injuries that anyone's going to have. You know, we got high school, all sorts of sports coming back in here. People are getting back into it. Injuries happen a lot. It's incredibly common. One of the most common things that's going to be in the ER, or really anyone deals with.
Okay.
Now, you were talking a little bit about trying to strengthen the ankle. Not the ligaments, but the tendons, which could prevent sprains?
Yeah, so a lot of times when people have a bad ankle sprain, they're going to tear or rupture or sprain or even stretch out one of the ligaments. That's going to take some time to heal up. So what we're really looking for when we send people to physical therapy is trying to strengthen up some of the supporting structures around it. That way, we'll also try to add ankle bracing or taping, like you were talking about as well, to try to give it a little bit of mechanical support while those ligaments heal.
Now, after you have a sprain, is it more common to keep spraining it again and again?
About 85% of ankle sprains are going to be healed with no long-term problem.
Okay.
And that's a typical thing. That's why so many people have had them, and so many people just don't really think about it. You blow them off because everyone's had them. But there's about a 10 to 15% chance that people have chronic problems, and that's where we'll have people that continue to sprain it and have problems, and it's weak. They'll roll it on the sidewalk. They don't like to lead even getting out of the car with it because they're afraid that it's going to give out.
There's so many things in drugstores and places like that, you know, ankle wraps and better tape and all these sorts of things. What do you think? Is old school still the way to go? Or are there some new things that you can pick up over the counter?
Well, I'd say old school is still, there's a lot to it. I mean, there's a lot of good mechanical support that we have. When I have people that want to get back into more athletic endeavors and stuff afterward, a lot of times I'll find a brace that has an articulation or a hinge at the ankle. That way it allows it to move up and down really well, but prevents it from having the in and out that really
And
is
that
the
sometimes
sprain.
feels more natural, too, when you're still playing.
It allows people to really, that's an important motion. You're supposed to have that kind of motion there. So if we can protect it while still allowing for an active amount of motion through it, it is beneficial.
Now, it took a long time, but high-top shoes came back in vogue after the low-tops. Was that a big improvement in the lesser sprained ankles?
Well, you know, it's a nice way to kind of keep these things protected. People a lot of times won't need a brace if they're not doing really aggressive athletics. Just having something high top, or you know, I see a lot of people that are working as well. It'll be in you know, high lace-up leather boot. That's going to be real supportive as well. You need something that's going to provide a little bit of structure to you.
But once Joe Namath came out with the low-cut white shoes, and Johnny Unitas was wearing the old black high tops, if you wanted to be cool, what did you do?
He heard a generation, huh?
Exactly. That's why I have bad ankles.
That's who to blame right there.
That's
All
right.
Well, if you want more information and tips on how to avoid those ankle injuries, just visit our website, NBC26.com, and click on this story. Thanks so much for being with us.
Thank you.
And if you're looking for a